So my name is Kathryn Hautanen. I am the director for the Center of Health Experience Design at MadPow, and I just want to give you an introduction to it. It was launched last year, but we've really gone full out this year and blown it out into a full organization with a membership program. So benefits of membership of this Center for Health Experience Design is that it's really designed to enable networking and relationship building. As we all know, healthcare, the problems are really complicated, complex. There's so many stakeholders involved. If you try to do it in your own organization, you're not going to make much progress. So this whole organization is designed to connect people like we are in this room today, but throughout the year working on specific projects. We are offering immersive learning and professional development. We already have a workshop series that we've already been doing for a few years. And those give you specific training in things like experience design or designing for mental health, etc. We are really proud of the concept that we're working on governance for multi-stakeholder projects. We really are trying to take on those really complex projects and be the center of these things. And then we're also offering access to our subject matter experts to help move your work forward. There's also access to a community, you know, that Mobilize app that everybody's been talking to you all day. That's the community we're talking about. That is what I want the conversation to get started. So HXD is designed to focus on tough problems. First off, we have the online community. Again, the Mobilize app. You can also go to mobilize.io to sign into your account. Everyone who's been registered, I sent an email, you may have gotten more than one from me, about setting up your account, but just get in there and you can start chatting with everybody else. We also offer a membership, and we also offer some multi-stakeholder projects that you can get involved in. So I want to talk to you about two projects that we have in flight right now, and we're actively looking for people to join us on both of these projects. We're working with Mass Health Quality Partners, and the title of the project is Engaging Patients and Clinicians in Envisioning a Better Approach to Pain Assessment. So that's a fancy way of saying that we really were looking at how pain is assessed right now on that whole 10-point scale of like sad face up to smiley face and how ineffective it really is. And so we looked at some examples of how people are addressing opioid pain addiction and treatment at this point in time, and realized that even though there were a lot of things being done, like reducing prescriptions or other ham-fisted kind of attempts to reduce opioid addiction, there was actually nobody was really doing the work with putting the patient at the center of the whole conversation. And as Latrice talked about and during her sickle cell warrior conversation, it's about the patient is the best one to be able to understand and communicate what their needs really are as far as pain management. So in this project, we actually interviewed a bunch of patients with pain, as well as doctors, nurses, pharmacists, and payers, all of which we considering at the ecosystem of pain, and trying to really understand everybody's point of view and what the challenges were and how we could develop solutions. So what we've done right now is we've completed the phase one, which is the research I just talked about, and we're very grateful to Cigna for funding that. We're actually going to talk a little bit more about the research that we learned, all the information and the data. It's going to be at a Lunch and Learn tomorrow at 1 o'clock, so please come and join us if you're interested in this topic. We also have a webinar on our center website, so if you go to centerhxd.com, you can watch the webinar talking about deep dive into the research. And as I said, we're actually building a team to move forward, to move into phase two, which is actually designing and building a prototype and testing it, which is a really big deal, right? So this isn't just theory. We actually want to build. We're trying to get something that actually can be deployed out into the wild. So in order to do that, we need partners. We need funding. We need people that have access to patients. We need patients. We need a lot of different things. So we're looking for a bunch of organizations to step forward and help us with this one. We already have Mass Health Quality Partners is continuing the work as being a leadership in this. We also have a surgeon from Beth Israel Deaconess Medical Center who has been really kind of challenged with how do I appropriately prescribe opioids after surgery to make sure that people do not become addicted. We actually even have an art student that ended up developing a visual language for pain for our MFA. But we're also looking for additional people to come and join us. So I'll be out here drinking cocktails. Please come and talk to me. We'd like to get you involved. The other project we're working on is with Commonwealth. They're a nonprofit here in the Boston area that really work on financial solutions for lower income people, and what we're looking at is a solution around benefit selection for financial security. So it's really about those people that have incomes less than $55,000 and how do they select their benefits at open enrollment in order to protect their financial security. Not everybody has a choice, or people are just giving high deductible health plans, but people are just kind of winging it. There's no real intelligent way that helps them understand what's the best choice. If I have options, what's an HSA, what's an FSA, I have no idea what's going on. And as Amy said earlier today, that medical debt is the #1 source of personal bankruptcy filings in the United States. And people that in this bracket don't have the $400 in a bank account that would help them pay that surprise medical bill. They're very vulnerable. This could be devastating. So it's something we're actively working on right now. And like just more information about this, that 1/4 of US adults struggle to pay their medical bills. In 2014, 40% of Americans racked up debt resulting from a medical issue, and that even though workers' earnings have only increased 6% in the last few years, that the deductibles have increased 63%. So this is an area that's really challenging. But the truth is that nobody can solve it by themselves. No health plan can solve it. No financial firm can solve it. No employer could solve it. So we're building together a coalition of these 3 employers, health plans, and financial organizations to try and find solutions for this, looking at it from the open enrollment process, the plan design process, and the FSA HSA savings plan. So we are looking to design an open enrollment experience that the information needed to make your best selection is readily available and comprehensible. You may have seen a conversation going around in the Mobilize app talking about these tools that exist and nobody can make sense of what am I supposed to do with this. We're also looking at how might we design ongoing decision report to help people leverage financial vehicles such as their FSA, HSA, and HRA. And again, we're looking for sponsors where we're looking for people to help us with this. So again, please come and visit me out by the cocktails out in the lobby. We are looking to get more people involved in this. So let me talk to you a little bit about the brass tacks of actual membership in this organization. So here's an eye chart for you, and I do have it. There's a printout on every one of the tables, so if you want to look at it closely. We also have brochures out here. We have everything ranging from free, which is basically that app that you already hopefully downloaded, up to a really high-level corporate levels. But let me go into a little bit about what the value we're offering is. So this is the corporate membership level. We do have an individual one as well. But at the bronze level, you're going to get a bunch of free tickets to this conference next year, the workshops we had this morning, and tickets to our quarterly workshops. In fact, our next one is September 26th to teach you how to use Impact, the kit that was developed by our team at MadPow. You will also get 5 hours of subject matter consulting. So this is talking to our team about behavior change or organizational transformation or other things, experience research. But you get a one-on-one conversation with experts at our company. If you start moving up to the silver level, you get everything that was covered in bronze, but you also get the ability to co-lead an innovation workshop, kind of like what we did today. If you wanted to be up there and help controlling the content and having people work on problems that you are interested in, or you might want to do a curated online discussion. At the gold level, again, everything from silver, but at this point, you also get a design critique. And I know when I was in graduate school studying design, like as much as I hated design critiques, I knew they were the most valuable thing I could possibly do. And this is something that if you've designed a new product or service at your company and you're kind of wondering, are we all in group think here? Are we really seeing everything we need to? This is something you can bring to MadPow, and we'll review your work and give you a very specific design critique and tell you about this is working, this is not working, here's other areas of opportunity. Now at the platinum level, again, you get everything we just mentioned before, but it also comes with $50,000 of MadPow services. So this is actually a pretty big differentiator. A lot of other organizations in healthcare that offer you memberships, they don't include anything. So you might be paying X thousand dollars and it's a membership. We actually want to give you really specific value as part of the Center for Health Experience Design. So just in summary, that the center is a community of change makers who take a collaborative approach to improving health and humanizing the human system. So visit us out here, talk to me, get some more details, and we also everything up on the centerhxd.com website, so you can go up there and actually sign up right there if you're interested. So, and just one last thing is, again, I'm really pushing the online community. So we really are trying to get at this conversation that's happening today in the room going throughout the year. That we do have affinity groups, so every track has an affinity group in it. So you're able to continue conversations that may have started within the breakout sessions that we've had today and tomorrow. And it's free, so feel free to download it and start communicating with each other. Again, it's a Mobilize app. You can also access it online at mobilize.io. So we really welcome you, and we hope you will either join us in becoming a member today, join us in the projects. We're looking for additional people for it. So really join us in improving the experience of health. Have a great night, and we'll be back here tomorrow at 8:30 in the morning. So have a great evening.